time. Before modern police, cities had night watches and constables. Before professional fire departments, we had citizen volunteers and bucket brigades. Public safety is always changing to meet the needs of its communities. In fact, 50 years ago, if you had a heart attack or an injury, you would have to rely on a police car, taxi, or a hearse to get you to the hospital. So cities created the modern EMS, where trained paramedics could stabilize you. The basic idea was that medical emergency is not a law enforcement problem, it is a healthcare problem. And now this idea is mainstream. No one argues that police alone should respond to cardiac arrest or traumatic injuries. But today we continue to ask police to be on the front lines of all of our societal problems, from mental health illnesses to substance abuse and more. You dial 911 and no matter what the issue is, you'll get a cruiser and flashing lights. So as we confront rising mental health, homelessness, and substance abuse crises, and as we stand here on the verge of tackling another step forward in our evolving understanding of public safety, this charter amendment is the latest chapter in that long arc that has bent towards justice and progress. I know this firsthand. I've never told this story because it's deeply personal, but about 10 and a half years ago, before I was on council, someone in my very close family had a mental health crisis. We knew we needed help, and we knew we had to call someone, and we called for the police. We made sure that everyone else outside of my close family member and I were in the house because we did not want to be there for that interaction. Luckily, the interaction went okay, and we got them to a place where they could get help. It was the best option that we had at the time, and it saved his life. But what my family member needed is what we are here to champion today: an integrated, proactive, leading-edge model of crisis response. I appreciate the advocacy and leadership of the Columbus Safety Collective, which has been working to bring this vision to reality for years and years. For the last year, City Council members and my team have been working with the Columbus Safety Collective to see if we could collaborate and unite around a charter amendment to ask voters to take this step with us. Our commitment to that doubled after we got the results from the external consultant Mission Critical Partners that we commissioned to review our progress. It found that the city could be diverted 5 to 10 times more calls to our mobile crisis response unit if it were scaled up. And it found that up to a third of all incoming 911 calls could be answered by another kind of non-uniform specialized response. That would free up our police to do what their 1,000 hours in police academy uniquely equips them to do: to get guns and violent criminals off our streets. And our commitment doubled again when the collective turned in more than 30,000 signatures of citizen support, showing the community was already there. So tonight, City Council will vote to advance the collaborative proposal we worked on with the Safety Collaborative. This proposal will establish teams of uniformed professionals who can respond to nonviolent emergencies with the tools those situations of behavioral health or homelessness truly require. But it also is also a proposal that gives city more flexibility in funding and programming. As a show of good faith, that ordinance will also commit to a city, that ordinance will also commit the city to an earlier implementation deadline than their original charter contemplated, for these teams to be fully operational in 2028 and available as needed 24 hours a day, 7 days a week by 2030. I want to turn things over to the Safety Collective's current co-chairs, but I want to take a moment to honor people whose shoulders we are standing on today. Think about my good friend Stephen David, who came to my office 6 years ago talking about alternative crisis, to Paisha Thomas, to Reverend Tim Aarons. And I'm even thinking about my friend Amber Evans, who many years ago came to all of us advocating for more. Without the folks who pass the baton to the next, we would have never gotten here. So to Chana, who I'm turning it over to Emily, to all those who stood out in front of grocery stores and libraries, everywhere we went, you were out there talking to people. You did the work, you partnered, you made the case, you turned your pain into purpose. And because of that, we are here today. Chana, the floor is yours.
Thank you. Thank you, Council President Hardin. My name is Chana Wiley, and I'm the co-chair of Columbus Safety Collective Campaign, and I'm thrilled to be here today. This campaign is personal to me. I started this work because of the loss of my brother, Jerron Thomas. He was experiencing a mental health crisis and called 911 for help. Officers were dispatched, excessive force was used, and my brother lost his life. Jerron was incredibly intelligent. He was offered a full ride scholarship to Ohio State University when he was in 6th grade under the Young Scholars Program. He had so much ahead of him, and he should still be here. My love for my brother turned into a commitment to make sure what happened to him doesn't happen to another family. The Columbus Safety Collective was formed in 2020 by residents across Columbus who believed public safety had to look different. We came together to reimagine how our city responds when someone is in a mental health or behavioral health crisis. We held town halls, we listened to residents, and we heard over and over again was clear people in Columbus wanted an alternative crisis response system for a long time. The Columbus Safety Collective campaign is for the people, by the people. And this campaign's field program is run by volunteer canvassers and community members who showed up, knocked doors, and collected nearly 30,000 signatures because they believe our city can do better. This is what residents are asking for. We're grateful for the support of Mayor Andrew Ginther, our City Council President Shannon Hardin, and we now have all collectively come to a compromised ballot language that's moving forward this evening. Today, we are here because the City Council has the opportunity to move this issue forward and place it on the May 2026 primary ballot so people of Columbus can decide. We're looking forward to hearing the hearing, and we're grateful to Council and the Mayor for listening to the voices of the community. Thank you all for being here, and thank you for listening, and I'll hand this over to Patrick Higgins with ACLU.
All right. Thank you, Chana. It's an honor to do this work alongside you. Good afternoon. My name is Patrick Higgins, and I serve as Senior Policy Counsel for the ACLU of Ohio, which is a proud and founding member of the Executive Committee of the Columbus Safety Collective Campaign, along with our fantastic partners. It's an exciting moment to be standing in front of all of you today, not to declare victory for any one person or organization, but to celebrate a moment in which we are delivering on a collective vision for a city that better serves our neighbors experiencing behavioral health and other crises. Today's milestone is not happenstance. Instead, it is the result of years-long advocacy led by directly impacted people, advocates, faith groups, subject matter experts, and others who recognize that we can and should do better when it comes to the city's response for people experiencing crises. Throughout this years-long advocacy, the Columbus Safety Collective campaign heard from all kinds of stakeholders, including those who challenged us to think about things differently. While it is no easy task, the campaign is indebted to the many people and voices that made the campaign and ultimately this proposal better, and it was worth it. Today, in the same spirit of collaboration and improvement, we present a unified vision with Columbus government officials in the form of a new community crisis response amendment. Our commitments remain steadfast. This amendment creates a community crisis response system that features system integration from the moment of a 911 or other emergency call. It creates an advisory board that will evaluate the community crisis response system, and it will fund the community crisis response system's development, implementation, and sustainability. Let me be clear, today is far from the end of the Columbus Safety Collective campaign. While we celebrate this historic agreement, today is the start of heightened collaboration that will transform our city for the better. Now, I'll pass things off to Executive Director of Ohio Families Unite for Political Action and Change, and my friend, Emily Cole.
Good afternoon, everyone, and thank you for joining us on this historic day. My name is Emily Cole. I'm the Executive Director of Ohio Families Unite for Political Action and Change, or OFU-PAC. Our organization is proud to co-chair the Columbus Safety Collective campaign. It's an honor to stand before you today in partnership with Mayor Ginther, President Hardin, all of Columbus City Council members, later leaders, coalition partners, and most importantly, the community members who have pushed the City of Columbus to reimagine public safety, aligning programming with the shared values of safety and accountability all of us hold. All of us, no matter where we live or what we look like, deserve the help we need when we need it during emergencies. Tonight, Columbus takes a clear step forward to advance concrete innovations to public safety service delivery, formalizing alternative crisis response as a critical pillar of our public safety ecosystem. Mental health stigma is real and impacts all of us. Healthcare providers receive extensive training to understand mental health, crisis symptoms, and appropriate de-escalation tactics. De-escalation for mental health differs significantly from the de-escalation practices we expect from our law enforcement professionals. To successfully support an individual in crisis while connecting them to needed services, we require a new line of service delivery. Tonight, we've come together as campaign leaders, elected officials, public safety servants, and community members to offer residents the opportunity to enshrine a healthcare-based response for folks in crisis into the City of Columbus's charter. Our joint initiative solidifies non-police crisis response as the presumptive first response where appropriate, ensuring the best expert responds to that crisis every time. By 2030, these services will be fully implemented and available 24 hours a day, 7 days a week, every single day of the year. Put simply, this life-saving program will ensure the right response for every call to 911 for help, from triage and dispatch all the way through to service delivery. Thank you to the people of Columbus, most impacted by the harm the wrong response has led to. Your leadership, perseverance, and unwavering commitment to an innovative and expansive public safety ecosystem have carried us here. We're grateful to the community members who have consistently demanded a comprehensive, integrated, fully operational, and sustainable alternative crisis response system for the City of Columbus. The Columbus Safety Collective campaign looks forward to working in partnership with Mayor Ginther, Council President Hardin, with Columbus City Council members, with our labor leaders, and most importantly, with Columbus voters to enshrine Columbus's commitment to a comprehensive alternative crisis response program into the city's charter at the upcoming May 5th, 2026 primary election ballot. We hope you'll join us. Thank you. It is my pleasure to introduce our next speaker, who is President Hardin.
Thank you, President Cole, Emily, for your leadership on this. So tonight, my colleagues and I will take a historic vote to put the compromise language on the ballot. And we are excited about this campaign, continuing the conversation that the collective started, and that we are joining this amazing team. But it would not have happened. We would not be here today without the conversations and support of the labor leaders and my colleagues behind me. And so I want to just open it up to see if any of the labor leaders or my colleagues would like to add anything, because their voices is what went into the compromise and make this collaboration happen. Anybody?
I'll go after Stephen. Even though police usually get there first.
Didn't realize you guys were coming to a debate. Chana, Emily, the whole team, President Hardin, members of council, my fellow brothers and sisters in labor, I think it was aptly said already, right? This is not a finish line. This is the starting line of a lot of work that still needs to be done. One of the things I would say is, as we've kind of talked about, when we talk about innovating here in Columbus, public safety response is no different. And one of the things I would point out is Columbus firefighters, EMTs, paramedics have been at the forefront of every EMS response innovation in our country's history. The first cardiac care transport vehicle in the United States, right here in Columbus, Ohio. The first multi-hospital network and Columbus firefighter paramedic specialized mobile stroke unit, right here in Columbus, Ohio, where we are empirically moving the needle on patient outcomes all across our community. And so we see this as just a natural extension of that. Clearly here, I think one of the other beauties of our state's collective bargaining laws are that now to implement the mandate from, Columbus residents is we'll sit down with our partners in the city and, make sure that we have collective bargaining agreements across the city that reflect these mandates from the people we're here to serve. So to that end, I won't be any more long-winded. I think our police backup should be here by now. I'll turn it over. So thank you.
My best friend here, Steve Stein, this is every single day we do this. Brian Steele, President FOP. I have the privilege of representing 4,500 dedicated police officers, deputy in Franklin County. This was easy for us. As society's expectations change of how we handle mental crisis runs, as law enforcement, we have to adapt. And I was brought in early in this conversation. I can't thank you enough. We talked about some of our lived experiences, some of my personal experiences with family who at times needed mental health professionals. We understand there are times when it requires a gun and a badge to respond. There's times it does not. And if that kind of alternative response gets the individual in crisis the help they need the most safely and effective way to keep them safe and our officers safe, we were all about it. What's great is what this shows is we can all work together. When you bring elected officials, administration, advocacy groups, activist groups, labor, there's no problem we can't solve. And this is a model for the entire country. All right. And Columbus is different. Why is it different? We are special. And as my brother Stein said, we are not stopping. We stick together. We keep labor and all these individuals together. We will just make this a pillar and a template to continue to succeed. So thank you so much, everybody. We appreciate you.
I'm just in the background. I'm here for support.
Ross, would you like to?
Sure.
Yeah.
Good afternoon, everyone. I'm certainly honored to stand here today celebrating an extraordinary achievement by the Columbus Safety Collective, because you did more than just collect signatures. You all built a movement, you listened to our residents, you organized across neighborhoods, you brought together public safety professionals, public health experts, labor leaders, faith leaders, community advocates, all united around a simple and powerful idea that safety in Columbus must reflect our values. And our values are clear, because for years, the residents have clearly and consistently said that justice must be more than a promise. It must be practiced. Justice should not live only in speeches. It should live, and it must be structured into the very systems that respond when our neighbors call for help. And when someone in our community is experiencing crisis, they deserve to be met with dignity, care, and also competence. For too long, we've asked our Division of Police to be everything for everyone. Mental health responders, addiction specialists, housing navigators, while also asking them to focus on violent crime. We can't reduce violence effectively when the vast majority of our resources are spent on non-violent situations. Allowing police officers to keep the main thing, addressing violent crime and serious threats to safety, is not a retreat from accountability, but it is a smarter deployment of our resources. The right response involves the right people. A fully integrated, non-police crisis response systems ensures that when everyone calls for help, or when someone calls for help because a loved one is in a mental health crisis, struggling with substance use, or experiencing homelessness, a trained professional arrives who can triage, de-escalate, and connect that individual with the care they need. That is not just a policy innovation. That's moral clarity to me. I'm excited, truly excited, to vote in favor of this ballot measure, not only because it represents thoughtful public policy, but because it represents partnership. It represents a community and its government working together to build something better. The work does not end with signatures. It doesn't end with the vote. It continues with implementation, collaboration, and accountability. And I look forward to continuing that work alongside the Columbus Safety Collective, alongside all of my colleagues, and alongside all of the wonderful folks in this city who will work to make sure we bring a more dignified response and really effectuate true public safety in our community. Thank you all.
With that, I think we'll do one-on-ones. So if council members need to get ready for council, it's a big night too. But we'll we'll do one-on-ones. Thank you so much. Thank you all for being here.
Thank you.